By now, everyone knows that COVID-19 is a subject that's not easy to talk about. Because of the prevalence of the virus, scientists are quickly looking for a cure or some other alternative that can be used to fight it. While there have been many rumored cures, the one that's most talked about is hydroxychloroquine. In this video, we're going to take a closer look at this drug's origin and uses before we discuss whether it can really be used for COVID-19. Make sure to stick around until the end of the video to find out if hydroxychloroquine lives up to the hype. Facts Verse presents Hydroxychloroquine, COVID cure or harmful hoax? Let us know you're staying safe at home by clicking the like button. Then subscribe to the channel and click the notification bell for more videos. Hydroxychloroquine's origins. It's hard to believe that this drug has a history that dates back centuries, but in fact, it's one you've already heard of before. Despite the long, technical-sounding name, the active ingredient in hydroxychloroquine is from the bark of a tree. You see, back in 1638, the wife of a Spanish viceroy in Peru became ill from malaria during her trip to the New World. Rather than subjecting herself to bloodletting, a common form of medical treatment in those days, she decided on treatment from a local Incan herbalist. He ground up the bark of the cinchona tree and gave it to the viceroy's wife to drink. The result was amazing, and she recovered soon after. It seems the bark of this tree contained a very special ingredient. Quinine spreads worldwide. The viceroy and his wife soon returned to Spain, with plenty of this miracle tree bark. But sadly, this new medicine was confiscated by the Church of Spain. It was later known as Jesuits' powder, and it would take another 2 centuries before the main ingredient, called quinine, could be extracted from the bark. And though it was used for general purposes, including curing malaria, it found its way into a product you never thought would be so common. By the time that quinine powder was making its way through Europe, some of it was already being shipped to the early American trading stations. By the 1800s, quinine powder was being used as an additive in soda water and mixed with gin. This was the birth of tonic water, which turned out to be a big hit among those living in the southern regions of colonial America. Either called tonic soda water or Indian tonic water, these beverages all shared the common ingredient of quinine. Quinine as medicine. By the late 1920s, malaria was commonly treated with powdered quinine. It was further refined into a liquid form called chloroquine, before being used by the U.S. troops who were overseas in the 1940s. Sadly, it turns out that in liquid or powder form, quinine was pretty toxic if you took too much, so it needed to be refined to remove extra toxins that were still within the medicine. By 1945, they had finally refined the quinine through a process called hydroxylation. This is where oxygen is used to separate molecular-level materials and removing toxins that are attached to quinine molecules. By 1955, hydroxychloroquine was approved in the U.S. as a safer treatment for many types of malaria. But it didn't end there, as doctors were about to find another use for this miracle cure that would give people hope. A cure for lupus. Lupus was a huge problem for doctors in the 1950s. In reality, there was nothing they could use to help lupus patients. Some adventurous doctors began to look at the effects of using hydroxychloroquine as a treatment for patients with lupus. And while it helped with relieving symptoms and preventing SLE flares, too much of this new quinine medicine would have toxic results, just like doctors had noticed with previous forms of the drug. It was through extensive research that doctors began to see what this natural medicine was doing to the human body. One of the main effects that was noticed was how it forms itself over lysosomes. These are special cells in the body that absorb and destroy old cells. Hydroxychloroquine would bond to these lysosome cells and prevent certain symptoms of lupus to the point of remission. However, they were actually acting as an inhibitor rather than a long-term cure. Hydroxychloroquine in modern medicine. Some of the ongoing research that began in the 1980s was all due to the discovery of the lysosomes in 1974. The powerful effects of how these cells protect our bodies are somewhat similar to how jellyfish are immune to predators. With the introduction of hydroxychloroquine, various studies have shown that it blocks the symptoms of many illnesses and viruses. But the effects don't last forever, and it doesn't work on everybody. Those who use this medication in safe doses will show improvement for a while. So far, the survival rate for patients with lupus shows a 70% jump over those who didn't take hydroxychloroquine at all for treatment. You might be surprised at another use of this drug, which is for the treatment of rheumatoid arthritis. Arthritis is a terrible affliction that happens over time, usually resulting in swollen, stiff joints that eventually cause pain. While it can affect any joint on your body, the most common areas you see it are wrists and knuckles. Well, it turns out hydroxychloroquine is commonly prescribed to help with rheumatoid arthritis, and has been for years. The frequent use of hydroxychloroquine in the treatment of other conditions have led some doctors to believe it may be helpful in treating COVID-19. Some people have claimed to use the drug to aid the body in fighting the disease, while others are taking it preemptively in order to prevent the virus altogether. President Donald Trump is one of the biggest figures spreading these claims. He's been incredibly vocal in his use of hydroxychloroquine and has released multiple statements that he's taking it to prevent a COVID-19 infection. Whether or not the drug works, this is a dangerous claim. After his claims, many Americans have believed that hydroxychloroquine is an effective solution for treating and preventing a coronavirus infection. At the time of his claims, there's no evidence to prove that it's an effective treatment. Before any official health organizations could react to the president's claims, hydroxychloroquine started flying off the shelves. People around the country were trying to get their hands on it in order to treat and prevent the coronavirus. And why is this dangerous? The answer's simple. It's impossible to know how a person's body will respond to the hydroxychloroquine, especially if the coronavirus or other health conditions are involved. Like any drug, hydroxychloroquine is not without side effects, and people may be rushing to consume the drug before considering the risks. Hydroxychloroquine side effects. When used at a doctor-recommended dosage, hydroxychloroquine will have very general symptoms. These can include headaches, itching, nausea, stomach cramps, and diarrhea. Some people will have trouble sleeping, while others have no appetite. And though none of these sound life-threatening, there are certain neuropsychiatric effects that are still possible at these dosages. These include hallucinations, agitation, mania, paranoia, depression, and suicidal thoughts. Who would have thought that a simple ingredient from a tree bark can have so many side effects? While these are the more common symptoms, these side effects can become more severe and complex with larger doses of hydroxychloroquine. Consuming too much of the drug can lead to seizures, coma, and passing out from a lack of breathing. It's estimated that 3 out of 8 overdose-related incidents using hydroxychloroquine will result in death. While reports of hydroxychloroquine overdoses may be exaggerated, it's still important to consider these risks before taking the drug for yourself. And after the president's claim of taking it, the FDA released a statement to help inform the public about the drug. The FDA steps in. Ever since they approved hydroxychloroquine in 1955, it was always intended to be used to treat malaria. Alternatively, it proved that lupus and rheumatoid arthritis could be included, but only through prescription and under the careful watch of a doctor. As a result, they're very skeptical that this drug should ever be used for treating COVID-19. But as usual, there are always going to be researchers who are willing to test the ability of this drug. Until that time, the FDA hasn't given the okay to use hydroxychloroquine or chloroquine to combat this ever-growing virus just yet. They've also given a strong warning to people outside of hospitals who are putting their health at risk. Unless you have the explicit prescription from your doctor, you should not be taking this or any other medicine, as it could hurt you more than anything. Is hydroxychloroquine a COVID-19 cure? With very little news and reports showing any positive results using any kind of quinine to control COVID-19, it's still early to say. The drug has proven for years that it can effectively control malaria, but that can't be compared to SARS-related illnesses. The same argument might be said over the ongoing miracle cure for taking several vitamin C tablets. They might boost your immune system for a while, but sooner or later there can be disastrous results from side effects. As doctors have encountered from previous treatments for lupus, the side effects were obviously too risky when doses were increased. This was usually after their patients showed great improvements, only to suffer from the toxicity of quinine. Even if it sounds too good to be true, you never know what some alternative medicines will do to you. In times of crisis, there will always be occasions where there's a magical answer to solve the problem. While hydroxychloroquine has shown how effective it can be for fighting some conditions, we've yet to see the same success in tests on the coronavirus. So at this time, the FDA recommends that patients do not rely on hydroxychloroquine as a preventative measure or a treatment. Health officials are still at work to find the most effective cure for the current pandemic. Until they've actually given the okay to use hydroxychloroquine, you can do your part by helping to flatten the curve safely. Always wash your hands and avoid contact with people who aren't wearing masks. Now we'd like to hear from you. Do you think the cure for COVID-19 is out there, or do we still have a ways to go? Let us know in the comments. And if you enjoyed this video, make sure to subscribe to the channel for more Facts First videos.